All right, we'll go ahead and get started. Thank you for being here for our COVID-19/RSV media briefing. We will have District Health Officer Kevin Dick on the call today to provide a few updates for you. We'll have questions after. That's all I really have. I'll be putting in some stats in the chat that Kevin is going over. So hopefully those are useful. If you have anything further, feel free to reach out. Otherwise, I'll pass it along to Kevin Dick.
All right. Thank you, Scott. Thank you, everybody, for joining us today. As far as COVID-19, we're reporting 282 cases for the last week and a 7-day moving average of 40 new cases per day. Those numbers are close to where we were the last time we spoke, and overall, we're in pretty good shape. Our wastewater levels remain low, and our CDC community level is low. As far as hospitalizations, the Nevada Hospital Association said occupancy has improved for pediatric units in the north after surging over the last 2 months. And they're also reporting 32 COVID hospitalizations currently in Washoe County. Flu and RSV hospitalizations are declining, and COVID-19 hospitalizations are remaining flat. I want to speak a little bit about variants today. We're hearing a lot of concerns about emerging COVID-19 variants. So I asked our COVID-19 epidemiologists to pull a report of sequencing data to tell what's being detected by the Nevada State Public Health Lab here in Washoe County. And I'll try not to overwhelm you with this, but the lab recently sequenced 149 positive COVID-19 samples from December 1st through the 28th, so a period of about 4 weeks. The most detected variants were the BQ1 and the BQ1.1, which made up 80% of 149 samples. So that's roughly 53 to 54% of the sequenced variants were the BQ1 and BQ1.1. So CDC reported about a month ago that those variants made up about 70% of cases in the US. So what we saw, 53 to 54%, is fairly consistent with that. I think what we've seen traditionally is as we're seeing increasing levels of variants being reported in the US, it tends to show up here in Washoe County a little bit delayed. So it's a little bit behind, but makes sense how that fits with the national levels that we're being seen. As far as XBB, now much of our news nationally has been around the variant, the XBB 1.5. Early indications show that this variant could be the most transmissible variant detected yet. It appears to be more evasive to the immune system, and it binds more tightly to receptor sites. Of the 149 samples that were sequenced in Washoe County, those 4 weeks ending of December 28th, when those samples were collected, only 2 cases were the XBB 1.5 variant. The CDC said that over 25% of cases in the US for the first week of January were XBB 1.5. So our data is not as current as the first week of January. It's up through December 28th, but we see, just about 1.5% of our cases being that XBB variant through the 28th of December. So again, we're probably somewhat behind what other areas of the country are reporting, but we do have that variant here. And there's a great possibility that we'd see an increase in cases due to this variant and an increasing number of those cases that are due to the XBB 1.5. We're continuing to work with the state lab to pull their variant data, and we'll continue to update you as we get that. So you may be saying, well, what does this mean for us? I think it's important to know that while the situation has become much more improved for COVID-19, we also still need to be careful, and we need to monitor what's going on. And so we'll continue to track this and make you aware. And it's important to know, as we have this variant, that is more evasive and has a stronger binding with the receptor sites that we do have vaccines available is a good way to protect yourself. And this variant is also, both the BQ and the XBB are considered Omicron subvariants. So it's not a completely new and different type of a variant, and the COVID-19 bivalent booster is shown to protect you from the Omicron subvariants. So it's highly recommended. If you need a booster, our staff will be at the Boys and Girls Club today at 4 o'clock administering COVID-19 and flu vaccines. We'll be at our center next Thursday as well. Last Sunday, our team administered 111 COVID-19 vaccines and 141 flu vaccines at St. Peter's Canisius Church in Sun Valley. And I'm very proud of our team's effort for that. I also want to make clear that our nurses can also come to you. If you are homebound, bedridden, or have difficulty leaving your house, please give us a call at 775-525-4601, and we'll get you scheduled to have a nurse come out to be able to vaccinate you. Again, that's our homebound program number, 775-525-4601. On the RSV front, we're seeing a continuing drop in cases. Our team is reporting 112 cases for last week. We had 121 cases the last week of December and 151 the week prior to that. So it appears we hit a peak in late November and early December, and we're coming down from that. However, the levels of RSV infection that we're seeing are still higher than normal for what we would expect to be seeing this time of year. Also, our flu is kind of a similar scenario. Our influenza-like illness has decreased from 3.1% of cases seen by our sentinel providers to 3% in our last reporting period. And those levels, though, are higher than they were last year, and they've been higher. We had an earlier surge in cases that are now coming down somewhat, but we still have high levels, and our hospitalizations to date are at higher levels than we've seen for a while from flu. So again, prevention is important. Get vaccinated. The number of vaccinated cases that we've had hospitalized is fairly low. So most of our hospitalizations have occurred in people that weren't vaccinated for the flu. So get those vaccinations. It's also important to take precautions not to spread illness during this respiratory disease season. So stay home if you're sick, see your doctor, get tested, and avoid congregating with our most vulnerable citizens. And remember, those most vulnerable are our newborns, the elderly, and those with underlying health conditions. And so that concludes my remarks. I'll turn it over to Scott for questions.
Thank you, Kevin. If you guys have questions, please feel free to ask them, or you can type them in the chat and we'll get them answered. Okay, I am not hearing any questions, so we'll just do one last call. If you have anything for District Health Officer Kevin Dick. Okay, thank you very much, Kevin. Thank you all for being here. If you have anything further, feel free to reach out to me. This will be recorded, or it is recorded, and will be on our website soon. If you need the raw file, please email me and I can send that to you as well. Have a great day. Thank you.